Tell us, what are some of the uses of AI you've seen already implemented in healthcare?
Yeah, we've been working with many health systems across the country. Some of the initial use cases are, we're really seeing some early success of using AI, even generative AI, in my view. Primarily, the AI for document automation, where you take out these medical notes and fax documents, coming into the hospital facilities. There is a huge need from improving operational efficiency, reducing costs, as well as improving the clinical decision. By automating these documents, digitize them, and classifying, extracting information out of these documents, there is a whole lot of great information about patient data, whether it's lab records, information, medications, and referrals, and all of that, which doesn't necessarily exist instantly in the EHR systems. So converting these and leveraging AI from the NLP in terms of classifying and extraction, those are the type of use cases I see more. And then I think all other use cases are just, people are doing POCs, but have not gone to the next level.
I'm a big fan of AI applications in the realm of operational efficiency. So examples being around patient throughput and patient flow. How can hospitals better utilize the assets and investments they've made in their facilities? I think of it often of like an airplane onboarding and leaving, or a hotel room, turning the rooms over. How do you get those procedures up quicker, pay people admit in the ED faster, get people discharged faster? AI can play a very big role in that. AI can look at a disparate and diverse set of data points and be able to have anticipatory actions that can move on the realm of simple and small, such as surgeries 10 minutes early, nudge the environmental services team to be ready when the procedure ends earlier, or complex, looking at weather patterns, looking at prior year procedural and admission volumes, looking at the full moon on a Friday night, looking at all kinds of things that can anticipate longer term, more complex modeling. So you can load balance resources. You don't want to have too many resources that are underoccupied. You don't want to have not enough where people aren't being cared for. Huge opportunity for AI.
So healthcare is actually this time not waiting on the sidelines, and we're trying to at least jump in quickly. So we have seen areas where they create some level of efficiencies for both clinicians, some level of efficiency for patients themselves too, in terms of self-serve models. So some examples include really a virtual agent assisting patient with the how-to information. A step further than that is really a self-serve model, which is tightly integrated with EHR. Then we take it over to the clinician side. Ambient charting is coming in play, which is a huge game changer, because it's a real-time charting without really clinician needing to be in front of the screen. Common use cases. Then there is a use case being utilized in many organizations, and we are exploring, is about generative draft response for inbox, because that's another physician burden which we're trying to solve. And I'll add one more thing, Rail. We've been using AI for a very long time, but mostly on the infrastructure and cybersecurity thing. It's really the generative AI which has all the excitement built around it now.
So a lot of it's rev cycle. So we do a lot of revenue cycle automation work. And what you can do with both late revenue cycle process and workflow is embed LLMs. You train them. They're very purpose built for areas like claims denials. You can do it for prior auth, and have these models that operate and work with copilots or with chatbots, where it helps the staff in terms of a lot of the denials, administrative tasks that they do. They'll actually go through those, the copilot itself, and cut times down 30-40% pretty easily once you get an implementation in place. So those LLMs are purpose-built. They're running off existing data. Now, what we see a lot as a challenge with that too is you've got to have a good data governance, good data quality, good overall data technology stack to be able to run LLMs. And oftentimes organizations need to work on that first before they get to AI. But you do see a lot with revenue cycle. That's an area where organizations have a good amount of data they can work with. They've got defined workflows, and we can come in and start to implement that right away.
Awesome. Thanks, Eric.
Yeah, thank you.